Once again, Vape airs Thursday, October 17th at 7 p.m. on New Mexico PBS. So how does the state regulate vaping and e-cigarettes, and what's on the horizon? Here's producer Matt Grubbs again with the New Mexico Department of Health's David Tompkins.
How much can the state do to get its arms around the rise of vaping and e-cigarettes? David Tompkins manages community health initiatives for the State Department of Health's Tobacco Use and Prevention and Control program. That's a, as we said, long title.
Long title.
Well, we know vaping is on your radar.
Surely.
What does the state do right now?
Right now, we're working in conjunction with CDC. Obviously, there's a lot of news going on right now about some of the pulmonary issues that are starting to be recognized around vaping. So we are in very serious contact with the CDC at this point, looking at this from an epidemiological standpoint, doing some interviews, long kind of questionnaires with folks who have been hospitalized with the belief that this is vaping related, trying to put together that information to really look at what's going on here. We're a part, this is also happening in 20 other states right now, I think, so it's a, kind of a national response to something that we were not looking forward to, we
Sure.
didn't really believe that this was going to be so immediate and start to really recognize what's going on here.
One of the things that Shelley Manlev, our public health expert that we just spoke with, said, she talked about the precautionary principle. This idea that you figure out if something is safe and then you sort of put it on the market. Mm-hmm. Sometimes that happens with drugs, certainly. What's happening with that?
That's not happened in this case. There are some regulations that were proposed, but at this time, the products came out onto the market before they were really fully studied. And, we take a look at cigarettes and combustible cigarettes, and this, they were on the market before anybody realized what was going on with those. And it took a long time to bring that information, to gather the data, and to make the connections that these products are killing people. And they're still on the market. So, this has a lot to do with, obviously, with corporate influence, with societal norms that we were taught through very well-developed advertising by the tobacco industry. So we've kind of normalized tobacco. We don't respond to it in a way that would make sense if it were introduced today. If somebody came up and said, okay, we're going to introduce a new product to the people of this country, it's a product that will kill close to 1 out of 2 people who use it as intended, there's no way that that would make it onto the market. But we're in it. We're used to it. It's a part of our societal norm. That's changing. Cigarette use is certainly dropping as people become more and more understanding of what's really going on there. It becomes less desirable. We've had some good policy efforts. We know what works, and we've been applying it to combustible cigarettes and other tobacco products for years now, since the settlement with the tobacco industry, which
Sure.
funds our program and provides us with that opportunity to make a difference in communities and in public health.
When it comes to vaping, what we hear so often is that this is something that helps adults quit smoking. There are products out there that the state provides that do that,
Surely.
that are tested. What does vaping do? Do you know yet?
We don't really know yet.
Okay.
This is that case again where it came onto the market before it's been studied. And the industry, the tobacco industry and the vaping industry set that narrative. They have been advertised as a way to quit. We don't have evidence that says that that's absolutely true.
Okay.
We look at it today, yes, there is the potential for e-cigarettes to help an adult established smoker quit using combustible products and hopefully quit nicotine altogether. But again, these products are not FDA approved. We do have FDA approved products for cessation: patch, gum, lozenge. Those have been around for years. They've been studied. They're effective. In the state of New Mexico, we offer those products free through our Quit line at 1-800-QUIT-NOW and Déjalo Ya. So we have English and Spanish telephone lines and computer, internet access to those services.
Okay.
But they do include appropriate use of FDA approved products, and they're free. This is, if somebody really wants to quit, we have that in place for people here in New Mexico.
Okay. Do you have a sense of what the conventional wisdom is for the public when it comes to vaping? What it does?
We're learning every day,
Okay.
obviously.
Sure.
We certainly know that nicotine in any form is something that should not be used by youth, by young adults, by non-established adult smokers, and certainly not by pregnant women. So we know that. We know nicotine has harm to those particular populations. So we have to recognize that. We try to get that word out and help people to have understanding of what nicotine really means in order to make good decisions for themselves. At this time, these products they're not regulated. They're not regulated the same way that combustible cigarettes are. Advertising is not regulated. What's actually in the product is not regulated. Interesting that even as we look at the products and as FDA looks at the products, they look initially at what's in the product. We're just finding out what comes out of the product after it's heated, after it's mixed with flavorings, after it is ingested into the lungs. All those cause chemical reactions and changes. And so we can say, here's our list of ingredients that go into this product. But that's not necessarily what the user is inhaling. So that's an issue. We are really concerned. Our major concern right now is what's happening with youth, obviously. Flavored products are a way of marketing to youth. There's no question about that. We know that today. But we're not really regulating that. We are concerned very much that even with combustible cigarettes, 90% of the adult smokers today started using those products before the age of 18.
90%?
90%. We see something even stronger happening with e-cigarettes. You take flavors and you take an addictive chemical like nicotine, you put them together, and really what comes out of that is pediatric addiction. And that is our biggest issue right now that we're really trying to look at. We know what nicotine does to the developing brain. It changes the way that the brain learns attention. It's also, we're recognizing that in the developing brain, which is up till age 25, that it also trains the brain for other addictions. And so this, we talk a lot about many of the other addictions that are going on with urgency, and they're minimal compared to what's taking place with nicotine and nicotine addiction. Not to say that they're not important, they absolutely are, but when we take a look at how do we prevent some of those other addictions that are more likely to show up in adulthood, we can trace it back to training the brain in adolescence to become addicted to other drugs, and nicotine does that.
That term, pediatric addiction, that really it shocks you.
We don't think about it that way.
Yeah.
Again, we've been taught by an industry how to think about and how to look at these tobacco products. We're looking, combustible tobacco killing over 440,000 people a year. That's insane when you think about it. That product is still allowed on the market. if we had any other product that was doing that, it would be regulated off the market, would be taken off. Either we need to study it or we need to just accept this is a deadly product. So,
David Tompkins, we thank you for your time. We know you have a lot of work to do, and we thank you for that too.
all right. There we go.